Hi besties, welcome and welcome back to today's video. So today we're going to be talking about varicose veins and spider veins in details. I'm going to be telling you what is varicose veins, what causes varicose veins, the preventions, the precautions, the possible treatments, and some cosmetic treatments that you can do that is going to actually take it away from your leg permanently. So that is everything we're going to be talking about in today's video. So if you know that you are experiencing this skin condition, this particular video is for you. You are going to be finding a solution that is going to work for you depending on your pocket. Okay, so I'm going to do my best to break this video down to the basic understanding of everybody.
Your smile lit up like a sunrise glow.
Now, varicose veins or spider veins, they are swollen or twisted veins that lie just under your skin, and they usually occur on the legs. They appear to be green, red, purple, dark red, depending on your complexion. In varicose veins, they don't just come out once, they come out small and then they begin to expand. So once you just see a little trace of it, please start looking for possible treatments like this video and follow it to make sure it doesn't spread around your legs and get severe. Now, the primary cause of varicose veins or spider veins is weak or damaged vein walls or valve. Now, this damage on the vein wall or on your valve causes blood to pool in the vein, now allowing the vein to either swell, to twist, or to enlarge. So you might be wondering, what is weak vein, what is valve, and all of those things. Now, your vein has one-way valve that helps blood flow to your heart. Okay, now when these valves that helps the vein to pull blood towards your heart, when that valve gets weakened or when they damage, they can no longer close properly. And when the valve can no longer close properly, okay, it now allows blood flow backward and then pull in the vein. Now, when this begins to happen, when blood begins to flow backward in your vein, it now poses a pressure on your vein. When that pressure occurs, that is when your vein will start enlarging, it will start twisting, and it will start swelling. So I hope you have understood the process now. Your weakened valve, once the valve is weakened, then it begins, your blood flow doesn't through that place does no longer flow well again, which is going to cause that vein to begin to swell. So I hope you have understood it. Now, there are things that can contribute to the weakening of your valve. Number one is age. The older you get, your valve, everything on your body starts to get weakened. So this age can be number one factor that can contribute to weakened valve. Number two is pregnancy. Number three is weight, being overweight. Okay, the reason is prolonged sitting and prolonged standing. For those of you that work in offices where you have to sit down for hours, every day, month in, year out, you sit down for prolonged period of hours in the office, or you are standing for prolonged period of hours at your workplace. These things can contribute to this damage we are talking about. Also, another thing that can actually make you to develop this skin issue is genetics. Now, if your mother had varicose veins or spider veins, you are likely to get it. Or if your father had it, you are likely to get it. But if you are aware, you can actually work on it and prevent it from happening to you. Now, the preventive measures that has been advised is: one, if you know that you work in a place that you have to sit down for a prolonged period of time, or you have to stand for a prolonged period of time, take time to change sitting or standing position. When you sit down a bit, you try to stand up, walk around your office, look for something to do, go get water, go get something, just exercise your leg. So the number one way to, one, prevent it from coming your way, or two, you have started seeing the signs, to actually prevent it from enlarging more and having more pressure, is to exercise. Now, when you are exercising, it helps the blood through those veins to flow better. And when the blood is flowing better, okay, the swell on the vein that is going to make it to enlarge or twist more is not going to happen. So exercise is one way that helps that blood to flow better, to actually, prevent it from enlarging more. So these are the steps you can take. Then another thing is, if you are overweight, okay, if you're overweight, you can try to drop your weight. A lot of people who dropped their weight saw significant improvement in their varicose veins. Okay, another thing is staying hydrated. Now, when you stay hydrated, it helps your blood to flow better. Try to stay hydrated so the blood in every part of your body, including your legs, will flow better. Now, another way, okay, that is recommended is to use pressure stockings. Now, what pressure stockings does is to help you, is to aid your body with blood circulation. So that place, if you're going to work, if you're someone that wears, cover up clothing like trousers or something, you can wear your pressure stockings and go to work. So while you are sitting down or while you are standing, the pressure socks will aid your body in blood circulation. And then when you get home and take off your pressure stockings, do well to do light exercises, stretch your legs, take walks. Make sure you don't do anything that is going to put pressure on your legs. Make sure, if as you're taking your walks, you are walking gently, like you're not doing some vigorous things, okay, that is putting more pressure on the legs. Anything you are doing that is putting more pressure on the legs, in as much as it can help to, boost the blood circulation, it can do otherwise. Now, another remedy for varicose veins or spider veins is massaging. You can use any oil of your choice to massage those places. Massaging it also helps the blood to flow better. So you need to keep doing this religiously, okay? And over time, you're going to notice that the swelling is going to reduce. The swelling is going to reduce and it is not going to keep enlarging or keep spreading on your legs. Another way is to do some simple leg lifting. When you lie down on your bed, lift your legs up high to the Lord. Lift your legs on the wall. Okay, this will also aid proper blood circulation on that part of your leg. So just stretch your leg, lift your leg, try to walk around. Don't stay inactive for a long period of time. Just sitting down and keeping your body without moving your legs can also cause, your blood not to flow better. So make sure you are exercising, make sure you are moving around. Some people have actually increase their walking, like taking walks in days, taking like 1,000, 2,000. Someone even did 12,000 steps in like 2 or 3 days, and she recorded decrease in the swelling of the varicose veins. So just do these little things to put it in control. Everything I told you here, they are not permanent treatments. These are things that will help to, reduce the increase in the blood pressure in that part of your leg, to help your blood to flow better in that part of your leg, to stop the swelling from increasing. It is going to, when you exercise, when you stretch, when you lift your leg, when you stay hydrated, when you massage, it is going to help to keep that place, like it is going to help to prevent the varicose veins from not coming if you have not had it already, and if you're already seeing the signs, it is going to help it not to keep enlarging. Now, if your case is already severe, if you're already having pains, because it can be painful, if you're already having pains in those part of your legs, it is also advisable to take, pain relief medications and also visit your doctor. There are sure cosmetic procedures that can be used to treat varicose veins or spider veins totally, and I'm going to be listing them and explaining them for you. First cosmetic procedure is sclerotherapy. This procedure involves injecting a substance into the varicose veins, causing them to collapse and eventually be absorbed into your blood. This procedure is very effective for small varicose veins. That is when it starts developing, okay? When it has not become big and much on your legs, that is when this procedure is going to work. And this procedure also works very well for spider veins, okay? But if your varicose veins are well enlarged and big, this particular procedure alone might not work for you. Now, the second procedure is called endovenous laser ablation. Now, this particular cosmetic procedure is used for more enlarged varicose veins. This one is the most effective for enlarged varicose veins. Now, the way this is done is by inserting a thin laser fiber into the vein via a catheter. Then laser energy is used to hit and close up the vein. This particular one is very effective for larger varicose veins, and these procedures are not really painful, honestly. So the third cosmetic procedure is called radio frequency ablation. Now this one is also similar to the endovenous laser ablation. It's similar, okay? These two cosmetic procedures are going to totally remove, like it's going to totally clear it in weeks. Okay, so your cosmetic doctor is going to tell you how long and everything. They are going to tell you like how long it's going to take and all of those things. But these are the three sure treatments for varicose veins. Every other thing you are seeing will not totally remove it. Every other thing you have been hearing will not totally remove it. Okay, these are the three sure treatments that totally remove it, and your skin is going to become smooth and clear again. So every other thing I mentioned or you have been hearing, massaging and all of those things are just going to help to manage it. Those are things you are going to use to manage it. Those are things you can use to prevent it, okay, from escalating and all of those things. So these are the treatment options for varicose and spider veins on the leg. So if you have any questions, any concerns, let me know in the comment section and I will be here for you. Precaution, preventive, voila.